Hello everyone, I am Dr. Arun Kumar Mishra. Today I will talk on a topic effect of anxiety on heart. Anxiety is the body's natural reaction to any threat. Stress in the mind of a person increases the secretion of adrenaline and cortisol hormone. The adrenaline constricts the blood vessels and it has a direct action on the heart, leading to tachycardia, increase of the heart rate, and also palpitation may develop. Now, because of these hormones, there is increased blood pressure. When there is constriction of the arteries, there is increase of the blood pressure and the rate of the heart increases. The increase of blood pressure gives a pressure over the heart and the heart has to pump more. It has to do more work than the previous state. So, the supply of oxygen to the heart must be as much so that the requirement demand of the heart of work to be fulfilled. When there is imbalance between the demand and the supply of oxygen to the heart, the changes in the heart takes place. These changes increases the heart rate, tachycardia develops, and the tightness in the chest may develop, and even this can change to chest pain, heart angina also. Now the question is if the anxiety subsides after some time, the blood pressure automatically comes down and the patient person becomes comfortable. But when it lasts for a long time, then the tension is continued and the pressure over the heart will persist. And this pressure coming to the heart will make a change in the heart also. If the anxiety is very long and if the blood pressure is also according to, then there will be hypertrophy of the left ventricular hypertrophy in the heart, where the heart muscle becomes thick, and now the demand of oxygen again increases in that person. So the blood pressure must be reduced by any means. Now the symptoms of anxiety producing chest pain. This is also similar to the occlusion of the coronary artery, like tachycardia, palpitation, high blood pressure, chest pain, dizziness, and even the fainting attack may take place. So, I will describe here the angina which develops because of coronary artery disease. The pain is substernal, heaviness on the chest, tightness in the chest, and the pain is radiated to both the shoulders and even the arm. Now, the coronary artery may go into spasm also when there is a panic attack. This is one important thing, that when a person gets fear, he is afraid of something very suddenly, then the spasm of the coronary artery may develop and the patient may get chest pain. Now, I will discuss some other non-cardiac regions also which causes the differences of oxygen level in the heart muscle, like anemia, hypoxia, hyperthyroidism. In hyperthyroidism, the rate of heart increases and the demand increases. In anemia, the percentage of oxygen is less in the blood and which may be not able to fulfill the demand of the heart, and the person may get pain. And there are several other conditions also, like in hypoxia, when there is a problem in any disease in the lung which is not allowing oxygen in proper amount to the heart, then this can also produce chest pain. So sometimes when there is pre-existing disease in a person, like if already he has developed angina before, then the chances of anxiety will persist, because he will always think that I have such type of disease and I can get the angina again, and this is not good for the health of the person. So what should we do when a patient gets a persistent anxiety? This anxiety must be reduced anyhow by any measure, because going into the anxiety for a long time is not a good thing for the person, and this can be reduced by walking, doing mild exercise, so that the flushing of heart of the blood increases, and the patient must have a better sleep every night, and he should also change his mind in some different works also. This is all. If the person has angina, and even though after doing all this, if the patient is not relieved, so he should contact a doctor. Thank you very much.